welcome to this webinar. My name is Alastair Bitsóí. I am the Communications Director for Utah Diné Bikéyah, and I am greeting you from Bears Ears, the ancestral homelands of Pueblo, Diné, Zuni, Hopi, and Ute peoples, among other Indigenous peoples that call Bears Ears home. And I'm joined today by a team of UDB staff who are amazing, and they can introduce themselves.
Hi, everyone. My name is Ahjani Yepa, and I'm from the Pueblo Jemez. I'm coming to you all from Albuquerque, New Mexico. Pueblo Community Outreach Coordinator for Utah Diné Bikéyah. Thanks for having me, Alastair.
You're welcome.
Hello, everyone. I am Cynthia, coming from Monument Valley, Utah Diné Bikéyah's Traditional Foods Program Director.
Yeah, well, thank you, Cynthia and Ahjani, for being on this call. We also have Woody Lee available on the call. I don't know if, Woody, you want to say something really quickly?
Ja, het aanals are konti hanan hich il nehgid kodo yahadi kodon hich hat jige wuri li shi are kolta kadona sha but anen slon khatshini bashshin ashin da shnaldo shin da che bi kodo ben hilkon in nege kondi achin to ze da dan balkhet acho ini do bin yacho ini gishin kodo da hilkul net dole.
Oh, yeah, Woody. So the purpose of this webinar from Utah Diné Bikéyah is to teach and learn a new habit of wearing a mask. It is because of the COVID-19 pandemic that is impacting our Indigenous communities across the Bears Ears region. We felt at UDB it was necessary for us to show you how to wear a mask. And the wearing a mask is a public health order mandated from the Centers for Disease Control and Prevention, as well as our different native governments who have public health orders, like shelter-in-place orders in place in our various communities. And so some of those public health orders, all of the public health orders, including from the CDC, require all people, all Americans, all Indigenous peoples to wear masks when they're out in the public. And that wearing a mask is critical because you not only protect yourself from exposure to COVID-19, but you also protect or reduce the harm of exposure to COVID-19 to your mom, your dad. So the next part of this process that beyond the reasons why we should all are now required to wear masks, we're going to demonstrate how to wear your mask. We all have different forms of masks out there in our communities. And one that I have is one that ties in two different areas. And this is one that was donated to our communities in the Bears Ears region. And here, this is how I wear my mask. And this is the mask I wear when I go grocery shopping or go get gas, or just to wear, just to protect myself from others, but also protecting just exposure in general. And so this is how I would wear my mask. So this is what I do when I'm going out into the public. At home, I don't wear the mask because I live by myself. And so like I put it above my ears and then I tie below my neck. It just goes around my neck. And CDC guidance says that it should be above your nose, covering your nose, and below your chin. And so this is what I do to wear a mask. And so this is how it looks. It fits. And I don't know if you have any other suggestive questions, but this is what Alastair does to protect himself, but this is what UDB staff is doing to protect themselves as well. And Ahjani?
Yeah, I have a mask here that we made at home. Made a few with my mom. And so this one just hangs around my neck, and then you can just cinch it up and tie it kind of the same as Alastair, over my ears and behind my head. And this one, it has a little opening you can adjust so that it fits snugly. And my daughter and I have been wearing our masks when we go out on our walks. And so we've been planning our walks in the morning and evening because in the middle of the day it can get a little hot. But yeah, in New Mexico, we are under a public health order where we are required to wear face coverings or masks in public. So anytime we leave our home, we are starting to bring this into our routine too.
All right, Cynthia, do you have thoughts on how you wear your mask? You have a different form of mask.
Yeah, I have a disposable face mask that you often see in clinical setting. One side is blue, the other side is white. The white side is like the filtering side, and it has ear things attached to it. So I just loop it around my ears like this, and on the top side there's a metal inside, so you want to pinch that metal over your nose and pull the bottom portion over your chin and make sure it fits perfectly so that you try not to get any opening spaces, and that's how it looks. And with this one, there are some claims that some people wearing it in the public that wearing it on the white side on the outside means you're not sick, and wearing the blue on the outside you are sick. But medical professionals are saying it's a false claim, so I don't know how much truth is to that. But as far as taking care of this mask particularly, they recommend not washing it because water damages the filtering of this material, and it's a disposable mask. And also they say that if your breathing resistance increases, it's a sign that your mask is either dirty or damaged, that you should replace it right away. So those are tips for these medical masks. The model is DY95.
Woody, do you have suggestive recommendations on how to wear a mask from your end?
Hakoshina ko de nakachin kujet Utah Diné Bikéyah agenda nishige kodoti git ya e de hachin to hazetaden balgi hot ya e chon ilo hot ya e Ahjani yen hilta hal ne deshe ko tanno ishidi ko atan stolz na ge hachin to le hacha banana banast edo le hayat in gun enjunu ya e ayuko nestik na haloshe ya e خني باصل صوت له أرو إيدو تقول يا إن لي بتكت أول هاللون وإن لي بتخص يحتاج كأشين يلتقي بتشتلو أرو إنت يا إيش يشون هو أرو دي كتو خان سوشين يحت أيو بتش نزل نهلو نايس تزيه وشين يا دي دي زي دارن بالجيت أيو يجي وشين تشوز إن إيشين يا دي كتو نه نلشيجي دو يو يا لنا ليندا إيشين نهاوش دو ليل خاص دو كيس إيدو تقول لحوت إيه دا ناس دو ليل ako digit ashen ya e beta khayano e ya e khot ya so inigit akon halshin yen kisna hasna don hilishan ila.
Thank you, Woody. So as you can see, we have different forms of masks that we recommend and tips for you all to wear. And if you go to the CDC, there is guidance on how to wear a mask on our face cloths. And so here is what we recommend. So go to cdc.gov, and once you go there, go to the coronavirus disease 2019 link, and you can see the best or better practices on how to wear a mask or cloth-based covering, and including homemade cloth bases. And so the cloths are these masks, whether they're PPE that Cynthia is wearing from the clinical setting, or what Ahjani and I are wearing from cloths. They're different techniques to wear and maintain, but also to clean. But for the purpose of this webinar, we just want to encourage you all to make sure to wear your masks to prevent spread of COVID-19 or exposure to COVID-19. And so like that's important to know because right now, as of this week, the Navajo Nation, for example, now has the highest infection rate of COVID-19 per capita. For a while, the Navajo Nation was behind New Jersey and New York behind infection rates, but now it's our communities are now impacted. The recommendations for people out there, Ahjani, Cynthia, Woody, on why we need to wear these masks more than ever.
Die kodo ye go de konke huit ni ye de nani tlini do ko khan so shin ya di shin pe anil so shin pe ta hui li ya khalati qadat git ya di si ye go ni khaton na di ko de nani tlini ni ke ya khai le khana go do ke da na ja do khata ho so go ji git si bilahane la de ya na il kitselni ako shin do be ta hui li ya ni gi bin na ko na la ya kita hades na di kon hit na do han so shan ya in ala bana da hidilia ako chi ti do be ta hui li ne gi bin na she hot ya di ko do di na ni gi do ni kas ti do che kha ni de in hossen ako di la do chi ta den ba ni do la do ya ne hui do li do ni go chet hui do li bin ya di kon ka ga ka ni gi han so shan ya di azebet thingi to yego yenalnish eshen yadi minil kon yego beta akhil yadi kon anil so en hidet in khalchen bedet idoni hastui akodi kodoni hinat as arota eshen hat ado yen hiltahal ne do ya yalti ko di kodo etel na ho eshen don hi kastida di be na di zigi ni jail zoli shen elsko ado lebi ille aro shen chigi an khane di leto ad shen na hon ile die hot yego na nahgi ano die chini yajen lengi kont ati non kedil logi do ati kogi do ati atona asi nahon kedil yedigi to tapetel nahgot o benna de tani ado ya khoni zingi ya de kodo chini yajen lengi betsad hollongi de kon ya khan so shan ya it's ne hoyi ni don ne kitchen ako ajo don kha chini yajen lengi yego ya bebchen ba hastido be ba hon zindo be ba khayani gibinina edi kon zedaden achintaden ba li ye go chino ido ye go bo do be ich hol ne do be na ich not hin aro in da ya hani bin adet eshkel no son shel to di kon ne chen han khalchen ne chen han ay la ye ko da hol ne edo da ya kon ne chapter na has ango landa ant le hon has ango kon hin khatnas ne le to chr at isen ye kon wat khada khai edan de do kit aro ston de ben da bin no kha tin khashu no tan kha lle ti do ya la so be da hui lian ro le no go hot abe na o kha to kit na an shi do hot ashan ya di be ket di le ko ye go da hot lian di no di ne sa do se zani do sa chen do anol so.
Thank you, Woody. Thank you for the language, the translation to our Diné audience members. But we want to thank you all, and we want to say that please follow all CDC guidance and Native public health orders, whether it's in Pueblo territory, Diné territory, Ute territory, Paiute territory, and counties. We have various counties that we all live in as well in different jurisdictions. So please listen to those public health orders at this time and wear your masks. Thank you again. Thank you for the time to talk with you all.